All right, let's talk about that moment you get a medical report handed to you. It kind of feels like you've been given a secret code, right? Well, today, we are going to crack that code. We're diving deep into one of the most common tests out there, the complete blood count, or CBC. My goal? To make you an expert on your own health data.
You know the feeling. You get your results back, and it's just this wall of acronyms and numbers. RBC, MCV, TLC, platelets. What does it all mean? You start thinking, am I okay? What is this trying to tell me? And trust me, you are not alone in feeling that way. So today, we're going to clear up all that confusion.
So, what is a CBC at its core? Think of it like a quick check-in on your body's entire workforce. It gives you this amazing snapshot of your overall health by looking at the three main teams of cells that are constantly working inside your blood. And believe me, these teams are working for you 24/7. Okay, so here's how we're going to tackle this. First, we'll look at why that report is so confusing. Then we're going to meet the key players, the red team, the white team, and the platelets. And you'll definitely want to stick around for the end because we'll talk about the most important part, what to actually do with all this info.
So, let's get into it. Your confusing blood report. A CBC isn't just a boring list of numbers. It's actually telling a story. And every single one of those numbers is a clue, like a little breadcrumb, that leads to a much deeper understanding of what's going on inside you. So let's follow that trail.
To really make sense of this, let's imagine your bloodstream is like a giant bustling city. The red team, they're your tireless delivery drivers. The white team is your highly trained security force. And the first responders, they're the paramedics who show up when there's an emergency. If you can get to know these three crews, you'll know your city inside and out.
First up, let's meet the red team, your red blood cells. I mean, these guys are quite literally the lifeblood of your body. They are the couriers, the nonstop delivery fleet, making sure that every single one of your cells gets the oxygen it needs to survive. Without them, yeah, we'd be looking at a total system shutdown.
Now check this out. The red team has two star players we need to know. First, the RBC count. That's basically the size of your delivery fleet. Then you have hemoglobin, which is the special protein that acts like the hands that actually carry the oxygen. If you're running low on either of these, that's a classic sign of anemia, which explains why you might feel like you're constantly running on empty.
But this is where things get really smart. See, it's not just about how many delivery trucks you have. The size of those trucks matters a whole lot too. And that's what MCV tells us. It's a fancy name, mean corpuscular volume, but it's a simple idea. What's the average size of your red blood cells? And for doctors, this one little number is an absolute game changer for figuring out what's really going on. And just look at this, it tells the story of two totally different problems. If you have a low MCV, it means your cells are smaller than they should be, or microcytic. That often points to a lack of iron. But a high MCV? That means your cells are too big, or macrocytic, which can be a sign that you're low on vitamin B12 or folic acid. It's incredible how one single measurement can tell such a detailed story, right?
Okay, so we've met the delivery crew. Now let's meet the security detail, the white team. These are your white blood cells, and they are the guardians of your body, the bouncers at the club of you. They are always on the front lines, fighting off every germ, every virus that tries to crash the party.
So, how do we know if the security team is on high alert? Well, we look at something called the TLC, or total leukocyte count. If that number is high, what doctors call leukocytosis, it means your immune system is in full-on fight mode. The bouncers are working overtime. On the other hand, if the count is low, or leukopenia, it suggests the security team is a little understaffed, leaving you a bit more vulnerable.
But this is where it gets really, really cool. The white team isn't just one group. It's more like a special forces unit with different specialists. You've got your neutrophils, which are the bacterial assassins. Your lymphocytes, they're the virus fighters. And then you have eosinophils, who are like the allergy and parasite police. By seeing which unit's numbers are up, your doctor can figure out exactly who the enemy is. It's basically CSI for your body.
All right, so we've got the delivery drivers and we've got the security team. Who's left? Well, the paramedics, of course. So let's meet the platelets, your body's dedicated first responders. The second there's an injury, these are the guys who rush right to the scene.
What's amazing is that these guys aren't even full cells. They're tiny little fragments, but you should not let their size fool you. The moment you get a cut, they are the first ones there, swarming the area and clumping together to form a plug that stops you from bleeding. They are seriously the unsung heroes of your body's emergency services.
So what about their numbers? Well, having too many platelets, that's called thrombocytosis, can be your body's way of signaling a bigger problem, like an infection.
But having too few, or thrombocytopenia, is a really serious risk because it can lead to dangerous bleeding. It's a delicate balance, and it's one of the main things doctors track in infections like dengue fever.
Okay, so you've met the teams, you know the players, you're probably starting to get a real handle on what your CBC report is telling you, but that brings us to the most important question of all. So what? What do you do now? How do you actually use this information to improve your health? You know, it's one thing to know that you might have, say, indicators of mild anemia. But what does that really mean for your day-to-day life? What foods should you be eating more of? Which ones should you maybe cut back on? It is so easy to feel completely overwhelmed with all the advice out there. And that challenge is exactly where technology is starting to give us some really interesting solutions. There are new tools designed to bridge that gap between the data and the action. For instance, a service like FreshVitals.in is designed to do just that, to turn your raw data into a clear, personalized roadmap for your health. The whole idea behind it is actually pretty straightforward. You just upload your CBC report. Their system analyzes your specific numbers, and then it automatically generates a personalized plan just for you. It's a way to get targeted advice that's tailored to your body's own data, and you get it almost instantly.
And you know, looking at this, it seems like it's designed to be really accessible to everyone. The full analysis and the customized diet plan comes out to 236 rupees. That really suggests the goal here is to make this kind of personalized health guidance something that pretty much anyone can get their hands on.
And it's not just some generic plan. What's really interesting is the level of detail you get. It gives you a breakdown of your critical results, plus fully personalized 7-day diet plans for both vegetarians and non-vegetarians, and even specific supplement recommendations if you need them. It's a pretty comprehensive package, all tailored specifically to you. And that right there is the key. A tool like this isn't just giving out random advice. It's built on your data. So if your report hints that you're low on iron, the plan is going to recommend iron-rich foods. If it flags low vitamin levels, it'll focus on boosting those. It's a really smart way to turn your health data into a real plan of action. So at the end of the day, your blood report is so much more than just a piece of paper. It's a roadmap to a healthier you. And now you have the tools to actually read it. So whether you use a service like FreshVitals.in or work directly with your doctor, the most important thing is to take that next step. Your health is in your hands. Now go out there and own it.